في مارس عام 2002 كان الشاب الجزائري محمد عصام البالغ من العمر 17 عاما يسير في سوق شعبي بعاصمة بلاده عندما تعرض لتجربة مخيفة، انفجار هائل نفذه صناع الموت، ولكن القدر أنقذ الشاب من الموت ليضعه في اختبار صعب. فقد تعرض لإصابات بالغة، عاش بعدها 7 سنوات كاملة في رحلة علاج طويلة ومؤلمة، نسي دراستته، حياته، انعزل عن العالم المحيط به، ولم يعد أمامه إلا أمر واحد يقوم به، وهو يخرج من غرفة عمليات ليدخل إلى أخرى دون أن يفقد إيمانه بالله عز وجل. حلقة جديدة من صناعة الموت، أحييكم.
Well, today this is the third operation that we're helping this gentleman with. Just to give you a quick brief of what happened to him. Unfortunately, Mr. Isam was involved in an accident that involved an explosion that caused him to lose the majority of the structure of his nose. And in addition to losing his right ear, and you will see in a few minutes.
The accident from bomb?
Correct. Correct. Unfortunately, you are correct. And this caused him a significant, both aesthetically a problem and also functionally a problem, because the nose as well as the ear have both very important aesthetic functions, but also they're very noticeable because the face is the first thing you notice when you meet somebody or you interact with somebody. So the case involved reconstruction of nose. To make it simple, is rebuilding a nose from pre-existing structures and trying to make it both functionally useful as well as aesthetically acceptable. Today our goal is two things. Number one, we would like to increase the space available in his nasal passage so that there's more air, he can breathe better. Currently, Mr. Isam is breathing more through his mouth, so we would like to open the nostrils so that he can breathe more, especially on his left side. He almost has zero air going through. That's number one. And number two is, when you see Mr. Isam, you will notice that he has a scar on his forehead. And the forehead was used to reconstruct his nose. And today we would like to make his forehead scar a little bit more acceptable aesthetically. And so those are the two goals today, what we call a forehead scar revision, as well as a left nasal nostril stenosis release, which is a medical word for opening the aperture for breathing.